It was just a collection of data of the CML patients that we have. So more than 60, I think 68 exactly, Italian centers decided to share all the data in their possession concerning the CML patients that they are following in order to have a view of what's happening in real life clinical I would say behavior and practice. And this is extremely important because most of the study, most of the data that we have on CML are just obtained from clinical studies or trials supported, spontaneous sometimes, but most frequently, more frequently just provided, sponsored by company and so on, in which some patients are excluded because of some of the things that are not considered in the protocol relevant. So in this case, we have collected really all the cases of CML which have been diagnosed in our centers. And this in our idea was just that this is something which is really corresponding to what is happening to our patients and which can be their outcome, and of course also in part of their expectation in real life clinical practice. The endpoint was in particular in this first analysis, because we are planning to have many more analysis in the future, is just to see which is the survival and which is the factors predicting for survival of the CML patients. And so we have considered more than 1,200 patients. We have seen the way their age, their honographical data, of course, is very important. And we have considered also the way in which they have been treated, or at least started their first-line therapy. In this way, we got important information about which is the best way to establish the prognosis. And on the other side, what we have to fear or to be careful about, and what probably is not so relevant. I would say, first of all, that the overall survival is extremely good, because the overall survival of the patients after 5 years is almost 85% of the patients. And what is really important, that the major cause of death is not represented by the CML, but by other causes. Indeed, CML represents only 1/4 approximately of the death, and these are mainly occurring when the patient is undergoing a progression of the disease. Whereas, indeed, but this is quite rarely occurring. And the fact that CML is responsible for the death of the patients is only present in, as I told you, in 1/4 of the patients, and therefore is roughly less than 2–3% of all the CML population. First of all, I would say that it's very important that to know that there are still some patients, unfortunately, dying also of CML, although few, as I said before. But we must particularly concentrate our attention on these patients, and we can identify them quite, I would say, in a good way, using the new scoring system that has been developed by the UTOS program, which is a modification of the so-called risk, in which the patients are subdivided about in a low risk, intermediate risk, and high risk. Fortunately enough, according to this new let's say classification of the patients, those in the high risk group, who are those that can more frequently can undergo a progression of the disease, are representing only 10–15% of the population. And so we can concentrate, particularly in this group of patients, our attention from the therapeutic point of view and to pay particular attention to them. Of course, when I'm saying that these patients are at risk of dying, they are not, I would say, risk of dying means that I would say their survival rate after 5 years is still over 60%. So not so bad corresponding to other leukemias, to other hematological malignancy. But however, this is a higher risk with respect to those who can be really, I would say, not fearing so much the consequences of their disease. No, I think that just the usefulness of collecting data is very important, because as I said before, what we are observing in clinical study, and which are sometimes the basis for the so-called recommendations that are international, like the NCCN or the European Leukemia Net recommendation, but may also be local, should be based on real-life data and not only on clinical studies, because it is sometimes is excluding some patients, so it doesn't give a perfect, I would say, picture of what is going on for our patients.